Hello everyone, this is Daniela from the Obstacle Doc, and today we're going to talk about diaphragmatic breathing. So diaphragmatic breathing can be useful for really two big purposes. There's many more, but the first is for intra-abdominal pressure. When you use the diaphragm, which is a big muscle that sits underneath the rib cage right here, as you pull air down with the diaphragm, you are increasing the intra-abdominal pressure because you're pulling air deeper into the lungs. If you breathe kind of apically or up through your shoulders, which Christopher is going to show, you can see kind of his shoulders rise and fall. He's kind of rising from here. We're keeping a lot of the air in the top of the body, in the top of the lungs, versus if he tries to pull the air down through the diaphragm, he's going to blow up a little bit more through the belly. Very nice. And that's going to pull the air deeper down. When you increase the intra-abdominal pressure, you are getting a little movement of the pelvic floor at the same time. So the diaphragm sits kind of at the top here, pelvic floor sits at the bottom here. And as the air pulls down, right, the diaphragm kind of pushes this way, pelvic floor has a natural little relaxed movement. It's not super dramatic, but it is enough that if you are actively thinking of a diaphragmatic breath, you can get a little bit of that lengthening, relaxation kind of moment. The second reason is for parasympathetic stimulation. So when we talk about fight or flight and rest and digest, these are concepts of the sympathetic nervous system versus the parasympathetic nervous system. So the sympathetic nervous system is what we would have said back in the old days, if you believe in evolution, that you saw a bear's chasing you, you got to run from the bear, or you're going to freeze from the bear, or if you were a bird, you would fly away. Or you're going to fight the bear. So that's your sympathetic nervous system. Your parasympathetic nervous system is what turns on when threat is gone, no more danger, we're going to rest, our body's going to do all the stuff that it does maintenance-wise. So when we do diaphragmatic breathing, we are able to stimulate the vagus nerve, which helps trigger parasympathetic responses. Similarly, if you're breathing up in your shoulders, you can actually trigger the sympathetic response because your body, through evolution, knows that that is your anxiety mechanism, right? If you're running from a bear, you're probably so if you were to breathe really fast, you're going to trigger that sympathetic response. If you start to breathe slow, you can trigger the parasympathetic. So that's kind of the two main reasons that we use that. So the way that we're going to try to teach Christopher to do this is first when we're laying flat. You can do this sitting, but I just find laying flat's a little bit easier to get more comfortable. So we can put our hands right over top of kind of right the base of the ribs. And what I'm going to ask him to do is take a big breath in and try to push into this hand instead of this hand. Let's see if you can take a breath in, beautiful, and let it go. Awesome. So the goal is not to worry about the exhale in this moment. It is only to focus on pulling air down through the belly. Take another breath in and out. Again, a little bit of chest movement is going to be totally normal and fine, right? As the rib cage expands, contracts, all of this is going to move. The goal is just that we're trying to move here first before anything here happens. The second reason this is helpful is because as you breathe in, if I'm going to turn to the side, if I try to breathe too much up through my shoulders, I'm going to do one of these. So here we're nice and flat. He can't extend into the table. So take another breath in here for me. Lovely. And let it go. Cool. Usually when I'm having people try to use this as a calming response, especially if it's in a response to pain, pelvic pain, or if you're on the toilet, I like to think of breathing in through the nose, blowing out through the mouth. That usually keeps you a little bit more under control. So in through the nose, out through the mouth. So for some people, diaphragmatic breathing can be difficult when they're laying on their backs. So another way that we can teach it is laying on your belly. Now he has the table to push into instead of a hand. So if you're kind of taking the view from the side, I'm going to have you take a breath in again, big belly breath. Good, and let it go. Cool, so what you should see is a little bit of this coming up. So do that again. Good, and let it go. Awesome. So now you have a different method of that tactile cueing to let your body know where you're trying to drive some force. This is sometimes harder for people, just depends on what's kind of comfortable in your own body. It can be really nice on a spine that's maybe stiff. So if you're sitting for a long time, standing for a long time, this can sometimes be really relaxing for this, almost like a stretch, because you're coming out of that flex position, or extended position, I should say. Diaphragmatic breathing, like I said, can be really helpful for toileting, voiding habits, any kind of pain management response. That's specific to pelvic pain, especially with any kind of penetrative activity, whether that is a pelvic exam or any kind of sexual activity, tampon insertions, things of that nature. If we go back to the fight or flight, rest and digest, sometimes the body goes into these triggering events where it feels like it's in danger, it's going to contract, it's going to get small because it's anticipating a threat. And using diaphragmatic breath to kind of let the body know that everything's okay, we're safe, we're going to try to relax instead, that can be really beneficial. It can also be a fantastic trick if you wake up in the middle of the night, need to go back to sleep, take a couple deep breaths, you'll be surprised how quickly you will go back to bed.